All right, I'm going to be starting my abdominal assessment here. First, I'm going to be starting by auscultating in all Tristan's 4 abdominal quadrants. Starting with the right lower quadrant, I'm just going to be auscultating with the diaphragm of my stethoscope and going through each one of these quadrants, making sure that I'm hearing normal active bowel sounds, which typically are going to be 5 to 34 sounds per minute. Everything sounds good there. I'm going to be switching to the bell of my stethoscope, and I'm going to be listening to Tristan's for any bruits in Tristan's descending aorta, which I don't hear anything. I'm going to move to slightly to the left and straightly to the right on either side to listen to see if there are any renal artery bruits, which there are not. Awesome. Now I'm going to start with percussing. I'm going to start doing that with this right lower quadrant and percussing all the way through all 4 of the quadrants. I should be hearing tympani throughout. If I feel any dull spots, it could be stool or any masses present. Now I'm going to start percussing the liver. I'm going to start doing that by the midclavicular line on the right side and at the umbilicus and start going up until I meet any dullness. Once I hear some dullness, I'm going to be starting from the nipple line and going down again midclavicularly until that tympani also turns into dullness again. That should be around where my liver edges are. That should be around 6 centimeters to 12 centimeters. Now I'm going to be percussing for the spleen, again, starting in the umbilicus and going up. I should be feeling more under the costal margin here, feeling if there's any dullness, and I do not feel any dullness at all. Typically when that happens, if I do feel any dullness and I do feel the spleen, that's possibly a sign of splenomegaly. Now I'm going to start palpating with light palpation throughout all 4 quadrants of Tristan's abdomen, as well as the flanks. Any tenderness on light palpation, Tristan?
Nope.
Awesome. Now I'm going to be doing deeper palpation and pushing down even more with my hands and as well as on the flanks. Any pain at all?
Nope.
Perfect. Now I'm going to palpate for Tristan's liver. I'm going to ask Tristan to take a big deep breath in. And I'm just going to palpate, trying to find that liver edge while he takes that big deep breath in underneath his right rib cage here, which I can feel there, which is great. And now for the spleen, I'm going to ask him to do the same thing on that left side. Take a big deep breath in and see if I can palpate any splenic edges. Typically, I'm not supposed to. Again, that's more of a sign of splenomegaly if I can. Awesome. Now I'm going to be feeling for any aortic, the aortic margin, so the aortic edge. So I'm going to be feeling for pulsation in that descending aorta. And then I'm going to slowly start to move my fingers apart until I do not feel any pulsation anymore. It should be around no greater than 3 centimeters of length at all, which it isn't, which is great. Excuse me. And now I'm going to be doing some rebound tenderness. Tristan, any pain at all when I'm doing rebound tenderness anywhere?
Nope.
Awesome. And now I'm going to also be doing some other appendicitis points. I'm going to have Tristan lift his knee for me. Awesome. And this is a psoas sign, and just push up for me. Any pain at all?
Nope.
Awesome. And I'm also going to be externally rotating his ankle and internally rotating his knee. Any pain at all when we do that?
Nope.
Awesome. Sounds great. Can you sit up for me, Tristan? Now I'm going to be checking for any CVA signs. So I'm going to put my hand along the CVA, and I'm going to be doing some hits on the top of my hand. Any pain at all?
Nope.
Awesome. If I do have any pain, this is possibly a sign of any kidney infection or any polynephritis at all. Awesome. Great job, Tristan.
Thanks.